Welcome to Sterile Pro Learning. Chapter 2 Medical Terminology. Medical suffixes are added at the end of words to describe conditions, diseases, or procedures. Learning suffixes helps technicians understand medical terminology more easily. The suffix itis means inflammation. For example, tonsillitis means inflammation of tonsils, while hepatitis means inflammation of the liver. The suffix algia means pain, while ology means study of. The suffix oma refers to a tumor. These suffixes are commonly seen in healthcare terminology. The suffix gram refers to a writing record or image, such as an electrocardiogram. The suffix pathy means disease or disorder. The suffix megaly means enlargement of an organ. For example, cardiomegaly means enlargement of the heart. Necrosis refers to a tissue death. These suffixes are commonly used in surgical procedures. Ectomy means removal, while otomy means cutting into an organ or body part. The suffix ectomy means surgical removal. For example, appendectomy means removal of appendix and tonsillectomy means removal of the tonsils. An otomy procedure involves cutting into a structure, while plasty refers to surgical repair or reconstruction. The suffix "refi" means surgical suturing or repair. The suffix "tom" refers to an instrument used for cutting. Root words give the main meaning of medical terms. Many roots refers to organs or body system. These root words are frequently used in healthcare technology and surgical procedures. Surgical roots are commonly used to describe procedures involving body structures. By combining roots and suffixes, many medical procedures can be understood easily. Prefixes help modify the meaning of medical terms. They may describe location, amount, direction, or condition. For example, hyper means excessive, hypo, low, endo, within, peri, around. In summary, medical terminology becomes easier when words are broken into prefix, roots, and suffix. This knowledge helps central service technicians understand surgical procedures, anatomy, and healthcare communication more effectively. Medical prefixes are word elements placed before the root word. They help describe location, direction, amount, condition, or time. The prefixes "a" and "an" means without. For example, asepsis means without infection and anesthesia means without sensation. These prefixes describe direction or timing. For example, post-operative means after surgery, while pre-operative means before surgery. These prefixes describe location or position inside the body. For example, intravenous means inside a vein, while extracorporeal means outside the body. The prefix hyper means excessive, while hypo means low or below normal. The prefix dis often refers to pain or abnormal conditions. The prefix intra means within or inside. These terms describe locations inside the body. These prefixes are commonly used in surgical terminology and procedures. The prefix bi means two or both sides. Bilateral procedures are performed on both sides of the body. The prefix hemi means half. These procedures involve half of an organ or body structures. The prefix peri means around or surroundings. Perioperative refers to all phases surrounding surgery, including before, during, and after. The prefix trans means through or across. This term describes procedures passing through body openings or structures. In summary, prefixes are important parts of medical terminology. They help healthcare workers understand procedures, locations, and medical conditions more accurately. Medical terminology is always changing as new surgical procedures and technologies are developed. Central service technicians must understand these terms because they are commonly used in the operating room. Most of the time, the OR team uses abbreviations or short forms to communicate quickly. Abbreviations are used in healthcare to save time and improve communication. They are very common in surgical settings, especially in the operating room and medical records. These are common surgical abbreviations. For example, CABG is a heart bypass surgery and ACL refers to knee ligament repair or reconstructions. These procedures include both diagnostic and surgical treatments. For example, IND is used to remove pus from an infected area, and ICD is a device that helps control abnormal heart rhythms. These procedures use cameras or imaging tools to look inside the body. They help doctors diagnose and treat internal conditions without large incisions. These are orthopedic procedures related to bones and joints. Some involve full joint replacements, while others involve fixing fractures or fusing bones. Minimally invasive surgery uses small cuts and special instruments. This reduces pain, infection risk, and recovery time for the patient. These procedures include general surgeries and treatment methods. For example, PEG is used to provide nutrition directly into the stomach through a tube. Understanding surgical abbreviations is very important for central service technicians. It ensures correct instrument preparation and support patient safety in the operating room. In summary, medical abbreviations are widely used in surgery. Central service technicians must understand these terms to support surgical procedures safely and efficiently. Understanding medical terminology helps central service technicians correctly identify surgical procedures. This ensures that the right instruments and supplies are prepared for each case, reducing errors in the operating room. If incorrect instruments are sent to the operating room, it can delay surgery and distract staff from patient care. Correct case preparation ensures smooth workflow and patient safety. Minimally invasive surgery uses small incisions and special instruments. It reduces trauma to the patient, lowers infection risk, and helps patients recover faster. In the past, most surgeries were open procedures with large incisions. Today, surgeons prefer minimally invasive techniques whenever possible. Bone fractures may be treated in different ways. Doctors may first try closed reduction. If needed, they may use percutaneous pinning or open reduction internal fixation. Gallbladder removal is usually done using laparoscopic surgery, which uses small instruments and a camera. If this is not successful, it may be converted to an open procedure. Chest surgeries often begin with thoracoscopic techniques using a camera. If needed, surgeons may convert it to an open thoracotomy. Breast surgeries usually starts with a minimally invasive biopsy. Depending on result, a lumpectomy or mastectomy may be performed. Prostate surgery may be done using a minimally invasive TURP procedure. If necessary, an open radical prostatectomy may be performed. Minimally invasive surgery is preferred because it causes less trauma and allows faster recovery. However, open surgery is still used when required. Every surgical procedure has two important parts: the approach, which shows how the surgery is performed, and the suffix, which shows the purpose of the procedure. These suffixes help identify the type of procedure being performed, such as viewing, cutting, removing, or repairing. Central service technicians are responsible for preparing case cut based on surgery schedules. This includes ensuring all correct instruments and supplies are ready for each procedure. Surgery schedules help the hospital plan procedures. Some cases may require both minimally invasive and open instrument sets. Some surgeries require loaner instruments provided by the vendor. This must be properly received, processed, and prepared in advance. Medical terminology is essential for communication between CS and the operating room. It ensures correct instrument preparation and supports safe patient care. In conclusion, understanding medical terminology and surgical procedures is essential for central service professionals. It helps ensure safe, efficient, and high quality patient care.